Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for apoplexy or stroke. Please note, this particular disease has got different names also. Someone called cerebral stroke, someone's called cerebral apoplexy, someone called cerebrovascular accident. These are all same thing. What is apoplexy? Apoplexy most often refers to stroke symptoms arising out of sudden bleeding in brain. Note the picture here. There is bleeding within the brain tissue or due to a clot in brain. Some clot in brain vessels, blood vessels, so that beyond the clot blood circulation is hampered, leading to sudden dearth, that is want of blood supply to an area of brain. Again, condition like subarachnoid hemorrhage also referred to as apoplexy. That is, this phenomena give rise to a lot of set of symptoms. That set of symptoms constitute disease: cerebral stroke, CVA, apoplexy, etc. I am coming to that set of symptoms. What are the causes of apoplexy? Main causes are only two: sudden bleeding in the brain, another embolism, that is blocking of an artery by a clot of brain. These are two factors, only two. In some books it is written as three. The third point is like this. They are saying that the trouble first starts in the heart, and from heart that particular clot of blood moves along the body, and sometimes it reaches the cerebral area to cause the same thing, that is embolism. Here I am blocking an artery by a clot of the brain. This clot is within the brain. They are saying that that clot might have been formed in the heart, then it is coming to cerebral area. The matter is same, embolism, that is blocking. Note the figure, face of the persons who are affected. The angle of mouth in one side drooped. This is the classical symptom of stroke. What are the signs, symptoms of apoplexy? Sudden confusion. Look at the patient's face. Trouble in speaking, understanding other speech. Sudden numbness and weakness in the face, limbs, especially on one side. Sudden trouble in walking. Dizziness, loss of balance, want of coordination. Sudden loss of vision in one or both eyes. Sudden acute headache, intense headache without any known reason. What are risk factors of apoplexy? High blood pressure, diabetes, cigarette smoking, heart diseases, history of atrial fibrillation, irregular rapid heartbeat, left ventricular hypertrophy. In simple language, the the ventricles is enlarged. Cholesterol imbalance, obesity, physical inactivity, alcoholism. These are the risk factors. That is, if one have these risk factors, one may fall prey to this particular disease. How to prevent apoplexy? Control intake of salt, sugar and saturated fat. Shun habit of alcohol and smoking. Take enough fresh green colorful veggies, fruits, nuts and beans regularly. Get moderate quantity of lean meat, fish and egg. Avoid strictly sedentary life. Keep body weight under control so that body mass index remains within 18.5 and 24.9. Control intake of dairy products, coffee and tea. Apart from physical training, in 5 to 6 days a week for at least 25 to 30 minutes, so that body tends to be sweaty. This is very important of all things. How a case of apoplexy should be managed? Case of apoplexy is always a case of medical emergency requiring a team of specialist physicians to attend on. If we get such a patient, our prime duty would be to refer the case to a hospital as early as possible. Remedies may be given if the same is available at hand right on the moment, but sending the patient to a good hospital is a priority and a must. We must remember this thing. Now we are coming to remedies, homeopathic remedies. Aconitum for apoplexy: full, fast, strong pulse, difficulty in speech, severe restlessness, fear of death. Give aconite 3 2 hourly. Mind this, apoplexy is a acute disease, so medicine generally will be of lower potency and frequency will be higher. Belladonna for apoplexy: face, eyes red, headache, visible pulsation of carotid, full bounding, heaviness in head and chest, abdomen swollen, vomiting of biles. Belladonna 6 2 hourly. Naxbom for apoplexy: vertigo, headache, heaviness, alcoholism, very irritable, debauchery, spending sleepless night, sexual excesses, constipation, etc. Naxbom patient is so much bad habits in his daily practices. Take or give Naxbom 3 hourly. Glonoine for apoplexy: vertigo, pain in frontal occipital region, photophobia, nausea. Glonoine 3 1 hourly. Opium for apoplexy: face dusky, heavy, sleeping with half open eyes, dilatation of pupils, extremities cold, respiration stertorous, pulse full or mild, unconscious or deep sleep. Give opium 3 15 minutes, every 15 minutes. Phatak for apoplexy. Apoplexy of old person, especially those addicted to excessive use of stimulating drinks, cannot speak, tongue affected profoundly, acts childish, great trembling of limbs, paralysis of right side, pulse full and hard. Give Phatak 6 3 hourly. Lachesis for apoplexy: stupefaction with loss of consciousness, with blue face and convulsive movements or tremor of extremities or paralysis, especially of left side. Lachesis for left. L for L. Blowing expiration after use of liquors. Blowing expiration, that is expiration when air is throwing out of the lung. This is blowing type. After use of liquors, there is alcohols. Give Lachesis 30 3 hourly. Pulsatilla for apoplexy: stupefaction and loss of consciousness, bloated and bluish red face, loss of motion, violent palpitation of heart, pulse almost suppressed. Note this, violent palpitation of heart. The heart is palpitating violently, but pulse is, you cannot get it. This symptom combination is an USP, uncommon, strange, peculiar. Many times I have I have already told, and I will tell also in future of this type of symptom, which are uncommon, strange, peculiar. One uncommon, strange, peculiar symptom give you right to pick up the particular medicine. That is, if this symptom is there, violent palpitation of heart. The palpitation of heart is violent, but pulse is almost suppressed. Give directly pulsatilla. No other medicine. Breathing rattled. Give pulsatilla 6 2 hourly. Arnica for apoplexy: head hot, rest of body cool, full and strong pulse with paralysis of limb, especially of left side, loss of consciousness and stupefaction with stertorous breathing, involuntary discharge of urine and stool, suits middle-aged person with plethoric and stout constitution. Ecchymosis, Here and there, ecchymosis, that is bluish discoloration on the skin, here and there, all over body. Give arnica 4-6 hourly. Here I will tell one particular experience of a topmost homeopath. Wherever he is trying medicine for apoplexy, he had been trying actually, in his experience he has written, and after the initial medicine he always that medicine, he follows arnica thereafter. First medicine may be say aconite, then he will give arnica, and with this practice he noted that the whole situation becomes smooth very nicely, and termination without any event. So I will ask my viewers to note this point, that you can follow this thing, that wherever you give some medicine in apoplexy, that is in cerebral stroke, your second medicine you will give arnica 4 hourly. Causticum for apoplexy. Paralytic states remaining after apoplexy disappeared. Paralytic state disappeared. Patients cannot find right word to express. That is, his mental faculty is still cloudy. Paralysis and contraction of the lower extremities. Causticum 4 hourly. With this the video ends. Thanks for listening and viewing. Any problem, please write down in the comment section. I would certainly respond.